The largest hospital in our region is changing how orthopedic surgeries are done thanks to a new addition to the team, surgical robots. Joining us now in the CTV Barrie studio from RVH is Dr. Ryan Perlus, orthopedic surgeon. How cool is this?
I mean, I love it. It's the occupation, the job I chose. And, you know, we primarily deal with people with various bone and joint diseases with things like joint replacements and broken bones. So it's really great.
Did you ever anticipate working with robots?
Early in my training, no. But I was very lucky to be able to be robotically trained with a fellowship in my last years of training, and it's really changed the way that I think about doing joint replacements.
So you did your first surgery with the two robots on Monday. Their names are Rosa and Stryker, is that right?
Mako is the name of the robot. Stryker is the company that...
Gotcha.
Yeah.
Okay, so what was that like having them in the operating room with you?
It's definitely a different dynamic. I mean, as I said, luckily enough, I've done a lot of them previous to coming to RVH, but I think it's great. I mean, everyone was really motivated to make it work, and the operating room ran smoothly. And yeah, it was a total success. We did 2 cases on Monday, another 2 cases on Tuesday, and another one yesterday, so we are up and running.
How does working with the robots change the process? Does it make things faster? Does it make it more precise?
It definitely makes things more precise. Traditionally, knee replacements, for example, have been done where we cut the bone and take all the arthritis out in a very systematic but unified way. So no matter if a patient is bow-legged or knock-kneed, we would do the same thing. And then after that was done, we would balance the knee and all the soft tissues accordingly. The robot allows us to actually do the opposite. So we actually do the latter first, and then we don't have to do any of the balancing afterwards. So it allows us to see what a patient's anatomy is like beforehand, make the cuts extremely accurately and precisely, and so we don't have to do all that soft tissue work afterwards. And so it's a much more of a personalized anatomy.
How do the patients react to that? Do they like the idea that this robot's going to be joining them in the surgical suite?
Yeah, I won't lie. Like, patients have asked me if I'll be sitting in my living room doing the surgery, but I can assure you that I am not. We're still fully responsible and fully in control in the operating room. But the robot itself, it's a robotic arm, and it's really all about improved patient care. And what it allows us to do is get patients up and moving faster. They often require less physiotherapy and get discharged from hospital faster, and really allow them to get back to all their activities sooner.
I understand more is on the way. Can you tell us? Do we get a sneak peek of what's to come?
Well, that's the hope. We're very lucky at RVH, where we have a committed team to technology and a surgical robotics program. And so outside of orthopedics, disciplines such as urology, general surgery, gynecology, also have robotic surgeries that are available to them. And so it's our hope to expand this robotics program to that. And that's really where we rely on our donor support at RVH. You know, the first robots in orthopedics were all driven by our donor support. And so really it's something that we can't replace, and we're extremely thankful for. And it's really exciting to have a community that's committed now for the future.
Very exciting. Thanks very much, Dr. Perlus. Congratulations.
Thanks so much.
Yeah, we've been speaking with orthopedic surgeon Dr. Ryan Perlus from the Royal Victoria Regional Health Centre.